Still dizzy after weeks of rehab? This one exercise might be making things worse, and you're probably doing it. If you're suffering from cervicogenic dizziness, a dizziness disorder that's triggered by pain in the upper neck, moving your head fast and up and down, side to side, this has a great potential to make your neck feel a ton worse. It can give you headaches, it can make you nauseous, it can make you throw up, and worst of all, after doing it for weeks and weeks, you're still finding yourself dizzy. In this video, I'm going to show you why shaking your head side to side and up and down can be a bad thing for cervicogenic dizziness, and most importantly, I'm going to show you 3 things that you can do to start getting some relief. Hey guys, welcome back to another episode of Physio Tips with Mauro. I'm your host, Mauro Burnett. For those of you that don't know me, I'm a board-certified orthopedic specialist in physical therapy, certified manual therapist, and a continuing education instructor for physical therapy for about 18 years. Over my 24-year career, I've treated thousands of patients with cervical disorders, cervical instability, including patients with cervicogenic headaches and cervicogenic dizziness. One of my passions. I see patients every day, all week long with these disorders, and I'm really excited to share with you some information today that I think could really help if you're out there possibly suffering from cervicogenic dizziness. First of all, let's start with a little bit of a definition of cervicogenic dizziness. Maybe this is the first video you've seen from our channel, and you're thinking, I know I'm dizzy, how do I know if it's cervicogenic? And oh, by the way, what in the world is cervicogenic? I'm glad you asked. All right, cervicogenic dizziness is a dizziness disorder not caused by the ear dysfunction or brain dysfunction, but it's actually triggered by pain in the upper neck. And it's way more common than you might think. The stats in the US, for example, are 8 to 9 out of 10 people in the US are now complaining of neck pain. If you have neck pain at the top, you have 7 vertebrae, C1, C2, and C3 specifically. When those joints are sore, it can cause headaches, dizziness, nausea. It can irritate a nerve called the trigeminal nerve, which it could even cause TMJ tightness. So if you found yourself, hey, I went to the neurologist because of this bad head pain, I can't quite figure it out. They did an MRI, my brain looks okay. And then I went to the ear, nose, and throat doctor because I keep having all the sinus pain and pain around or behind the eye. That's another branch of the trigeminal nerve. Maybe you've been to the ear, nose, and throat doctor or the balance center in your town, and you're like, wow, I'm really dizzy now, and I feel like if I move my head suddenly, I could lose balance. Those would be classic signs and symptoms of someone with cervicogenic dizziness. Now, sometimes it's tricky to figure out cervicogenic dizziness from other causes of dizziness, so it's important that we go through your doctors and you get all this stuff kind of ruled out. Make sure it's not cardiovascular. If you have lost hearing in your ear at the same time that you became dizzy, this might be related more to the nerve that goes to your ear and a vestibular dysfunction. It gets tricky because sometimes even patients that have diagnosis consistent with vestibular problems like Meniere's disease, you can also still have a cervical problem or neck problem, and this could make your dizziness worse. So the way we kind of look at it is, if you've been to all the doctors, you don't have a tumor, you don't have a sudden hearing loss, you don't have an acute ear infection, and you do have some tightness or stiffness in the neck, and you get the headaches and the dizziness and the nausea, and maybe your jaw's tight occasionally, that puts you in the bucket of saying you may have cervicogenic dizziness. So if you think that you may have it, some of these exercises may be a really big help. Now that we've got a pretty good idea on what cervicogenic dizziness is, now let's go into why moving your head side to side in a quick motion could make things worse.
Timing is everything.
So timing is everything when it comes to rehab. If someone comes to my clinic and they have a sprained ankle, the first exercise that we're going to do is not sprinting the 40-yard dash. Their ankle is not ready for that type of high-level activity. We're going to have to start small, we're going to have to start slow, and we're going to have to get their ankle stronger. We're going to get the mobility of the ankle better. We're going to get the pain, the inflammation down. And then we're going to do a slow, progressive exercise plan to build them up. At the end stage of rehab is where we're going to get to moving in a fast, quick, dynamic, ballistic way. Well, if we think about that, that's no different than neck rehab. If you just had a bad car accident, or maybe you've just had chronic neck pain for a long period of time, pain is going to cause your neck to malfunction in a very similar way of the analogy of the ankle sprain. With the ankle sprain, you lose range of motion. Your joints become stiff. Same thing with your neck. Joints are going to become stiff. You lose proprioception when you hurt your ankle. You don't quite know where your foot's at in space. Same when you hurt your neck. Your brain needs this information in order to control all the muscles at the right time to protect you. So we're going to have decreased strength, decreased endurance, decreased proprioception. That's that sense of knowing where your body part's at in space. That's a big reason, by the way, that they think that neck disorders can lead to dizziness. Proprioception is a third of your balance system. It's crucial that along with vision and the organs of your ear, that your brain gets this proprioception. So if our neck can malfunction in a similar way than our ankle, then we're going to have to do the same principles for rehab. What we probably need to start to do is avoid any type of fast, quick, ballistic exercise. If you go to a vestibular rehab center, it's very common that they're going to give you an exercise where you stare at an object and then you start slowly and you go as fast as you can staring at that one object. And the idea is that the reason that you're dizzy is your brain and your ear are not communicating properly. And if you just move your head vigorous enough for long enough, your brain will accommodate and the dizziness will get less. If that's not why you're dizzy, if you're dizzy because you have a neck disorder, moving your head side to side, up and down, this is going to cause a ton of irritation to your neck. It could cause you to have a severe headache. Many of my patients have told me they've gone to vestibular rehab centers and they literally would give them a garbage can and say, listen, you're going to throw up. It's okay. Just keep throwing up and keep doing it. Now, I suppose if you moved your head vigorously side to side and up and down for months and months and months and months, eventually your neck might get a little stronger and it may help to some degree, but it is a very, in my opinion, kind of a cruel way of going at it. I've been treating patients with dizziness disorders for many, many years, and none of my patients have ever had to throw up. When we make the exercises for them, is we keep it within their stability limits. If you're starting to get pain, if you're starting to have headaches, if you're starting to get nauseous, that's your body's way of saying you've got to slow the exercise down. Imagine you're in a fast race car and you're on the track and you're going as fast as you can, but you don't have proper steering. The steering's malfunctioning. You've got the speed, but you don't have the control. You're going to wipe out and bad things are going to happen. So that's a great reason why moving your head too quickly at the wrong timing can easily take your neck to a place it doesn't want to go and cause you to feel pretty terrible. Worst case scenario, you spend a lot of money, you do this rehab, it doesn't quite make your dizziness go away. Now you've got terrible headaches and you spend all the money and you're still out looking for someone to help. This happens to my patients all the time, so I wanted to share that with the viewers. If this is you, drop me a line in the comments. I'd like to hear your particular story. But let's go now that we've talked about what not to do. Let's now go and do 3 things that you can do that's been clinically proven to give you some relief. Our first tip for helping to decrease pain in the neck and cervicogenic dizziness is we have to address the way you sit and the way you stand. We have to look at posture. If I'm sitting, for example, with my back a little bit slouched and my chin 10 or 15 degrees upward, it's now going to put my neck in a slight bit of extension. And what's going to happen is the muscles at the base of the head, called the suboccipital muscles, they're going to start to become tight. Once they become tight, it's going to restrict my motion side to side. It's going to restrict my ability to flex forward. And I'm going to live with this constant tension at the base of my head. Remember, pain at the base of the head could cause dizziness, headaches, nausea, TMJ pain. So we don't want that pain and we don't want that tightness. What we want is your chin to be neutral. If your chin is neutral, guess what? The suboccipital muscles can't get tight like they could if you're sitting with your chin slightly up. Now, you may feel like, well, my chin's not slightly up, but if your back is slouched, you now have to bring your chin up to make eye level with the horizon. So the low back posture is very crucial. A nice exercise that you can do for your lower back and your neck is you start out sitting, purposely let yourself slouch to a point where you realize, okay, that's too slouched. Then you grow tall out of a slumped posture as far as you possibly can. Now you might realize, okay, that's too far. And then you come back about halfway. right? I'll kind of show you from a side view. I let myself slouch all the way. Then I grow tall out of a slumped posture. Okay, that's too far. Now I'm hyperextended, and then I come back. Now you're in this nice neutral position. If you can get your low back in a neutral position, it'll automatically start to put your neck in a better posture. There's a big correlation when someone has a really bad lower back. It could lead to bad posturing for the neck, and sometimes you'll see people that have back pain and neck pain kind of happening at the same time. So if you're sitting watching TV, or maybe you have an office job, here's a nice little drill that you can do. Every 15 minutes that you're sitting, try to grow tall out of that slump posture. Find this nice neutral posture for your neck. Relax your shoulders and hold it for 10 seconds. It stimulates the good protective core muscles to work, and it has a relaxing effect on your large, tight muscles. This is a great drill. You could set a timer on your phone. Maybe every commercial break if you're watching TV. Give it a try. It's a great start, but we've got to watch the posture. You can do all the great exercises in the world and all the flexibility and do all this every day, but if you sit all day with bad posture, guess what? You're going to undo all the good that you did with the exercises. So just like our parents taught us, sitting up's good for us. Posture is going to be our number one tip. Let's get into tip number 2. For tip number 2, we're going to talk about restoring cervical mobility. That's super important. If your neck is tight at the base of the head and you're restricted in rotation, maybe side to side, maybe extension, maybe flexion, the tightness in your upper joints can easily disrupt your proprioception and cause you to feel dizzy and loss of balance. Many times I'll test a patient on their first day in therapy, we'll have them stand on one leg, and I'll notice that they can't stand very long on one leg versus the other. I'm then interested in seeing how their range of motion looks like. Coincidentally, a lot of times a patient that has very limited right rotation of their neck will also have poor balance on the right side. So doing this technique many times will immediately improve the balance. So I'm going to show you a technique that you can do to yourself to help restore some range of motion. So let's go with the scenario that turning my head to the right feels restricted versus the left, and it causes dizziness. So I'm going to take my thumb, I'm going to place it down the back of my head, right past my skull, right where the neck begins, at the very top, the base of the head. I'm now going to place my fingers against my cheekbone. In a pain-free, dizzy-free way, I'm going to guide my head to the right as far as I can comfortably. If I get it right, what will happen is I'm going to help that C1 vertebra, your very top neck bone that could be restricted, I'm going to help it move a little smoother and possibly give it a little more stability, artificial stability, by holding it. I'm just gently holding it, rotate as far as I can comfortably, and you might notice, wow, I can go 10 or 15 more degrees without feeling pain, tightness, or dizziness. If that's the case, you can do up to 3 to 6 reps. When you're finished, reassess and see how you feel. If you suddenly feel like you have more mobility and less dizziness, this could be a great exercise to put into your routine. Remember, if we can improve your cervical mobility, you'll usually have an immediate improvement in your balance and dizziness. If it makes you feel worse, don't do it. Maybe find a great manual therapist in your neighborhood that can give you a little more guidance, but it's worth giving it a shot. So that's going to be exercise number 2. Something to help your cervical mobility. Now let's get into tip number 3. For tip number 3, we're going to talk about restoring cervical strength and stability. This is crucial. If we do techniques to loosen up the neck, like I showed in tip number 2, or there's the towel snag I've shown on other videos, these techniques can definitely help, and they will help, but at some point, we have to get your strength and stability back. If we don't, your neck is left in a vulnerable state, and you can continue to have repeated episodes of pain and discomfort. Once your neck gets sore the first time, pain causes a phenomenon called reflex inhibition. Pain reflexively inhibits the deep stabilizing muscles. They weaken, they atrophy, and now you're vulnerable to strain your neck doing a very small, mundane task. Getting your strength and stability back will improve your neuromuscular control, it will protect your neck, and suddenly you'll notice you could do many more activities that don't bring on pain, whereas before, just about everything can bring on pain and dizziness. I did several videos on cervical stability training, and I'm going to put a link up here on the next to me. I want you to click on that video if you haven't seen it on cervical strength and stability, and I want you to go and check out some of the exercises. Some of the exercises are fantastic. They've been research proven to decrease neck pain, decrease cervicogenic headaches, and decrease cervicogenic dizziness. When you give them a try, go slow. Start with just doing a little bit at a time. Make sure it agrees with you. If it makes you feel worse, do less. If it's a disaster, of course, don't do anything. And once again, maybe find someone in your neighborhood that you can check with. But when my neck gets sore, I typically don't go see anyone. I just start doing the strength and stability exercises. And pretty quickly, I'll start to come out of it and I'll feel much, much better. So strength and stability is crucial. One thing that I'll mention is laying down, slouching, recliners, and bed rest will never restore your strength and stability. That is the position where your neck's at rest. So if you feel bad and you find yourself lying down frequently for relief, and now you find yourself lying down or reclining most of the day, you are on a fast track to having your spine become worse, not better. So somehow, some way, if you can get yourself out of the bed or get yourself up and start to walk, even if it's just a few minutes at a time, walking with tall posture and your chin level is a fantastic exercise to start getting your strength and stability back. Why? Because you're holding a 10 to 12 pound head up against gravity and you're walking and moving, and that's going to start to activate the deep stabilizing muscles and it relaxes your overly tight muscles. On the flip side of that, when you're in microgravity or low gravity or lying down, your outer muscles become tighter and your core muscles become weaker. That's going to lead to worse cervical stability, more pain, more dizziness, and more headaches. So check out the video on strength and stability. Give it a try. Drop me a comment and let me know how it worked out for you. So there you go. 3 great tips to help decrease cervicogenic dizziness, and a really big reason why, if we're doing fast, quick, ballistic exercise with our neck too soon, it could make you worse. Thanks for watching today, guys. Don't forget to subscribe to our channel so you never miss any of our new videos when they're coming out. We appreciate you watching, and we'll see you next time on Physio Tips with Mauro.